they looked at me once and they realized that I had no idea, no understanding of the disease, no understanding of what I was dealing with. And I truly was absolutely clueless. Absolutely clueless.
Because you still thought that you had control?
Because I thought the alcohol was the only problem.
Got it. Yeah.
You
okay.
know, it's the substance. You take the substance away, that's it. You don't have the problem. And this is what the biggest obstacle into treating people with the same disease.
Got it.
Because people don't get it, especially people who have the disease, which tells you don't have the disease. And now they're going to listen to somebody else telling them that the substance that they're hooked to is not their disease. It's not. This is the gateway into a complete spiritual demise.
Got it.
That's what it is.
Okay. So you wanted just the medication. You didn't want all the other stuff. Okay.
I had no idea. I was one of the patients.
Right.
Take the alcohol out of me. I'll be stellar human. I'll be good as new. I'll be good as new. And that is exactly why I had a relapse. That is exactly why I had a terrible relapse. And that's exactly what brought me finally to the point where I ended up in the hospital in intensive care unit with my blood pressure being 70/47, with 3 ICU members trying to pump me with the bags of normal saline, and that's how my life was saved.
Did you say 57/47? Folks, if you're not medically trained, that is not a good...
It's that good blood pressure. It's not a good blood pressure. Later, I actually looked it up. There was a 70% that I was going to live, but there was a 30% I was going to die.
Which is high. That's a high percentage. Okay. All right, so you're in the ICU. How much did you drink?
Fabulous. This is the first time I'm in the studio like this, for sure.
But you've done podcasts before, just not in studio.
Yeah, not in studio, no.
Yeah, this
is much better. I like it.
You think so?
Oh yeah, I like it.
It's a bit much, but I think most people appreciate it when they first come in and see all the different stuff that I have going on here. So
just the effort to put this whole thing together.
New lights. This stand here is new. The cameras are new for the most part. I've never filmed with these cameras. What I would have to do before is I would have to stop every 30 minutes and restart the camera all over again each time. I don't have to do that with that anymore. These lights are new. And again, the audio, I don't know what's up with that.
We'll see what happens.
Yeah. So, okay. All right. No more technical difficulties at this point. Now we're headed around. So welcome back, ladies and gentlemen. This is the No Supervision podcast. It has been so long since I've done a podcast. I don't even remember how to introduce somebody. So I'm just going to make you do it. If you could, tell us who you are. Tell us what you do.
Okay. So my name is Andrei Dokukin. If you want to hear it in Russian, Andrei Dokukin. It's the same thing almost. What do? I am a physician. We are in mental health / substance use disorder practice in Long Beach. And by the way, thank you for joining our team.
Oh, thank you for inviting me. Yeah.
Which has been great. And I hope that everybody is enjoying working with you. Now, how did I come here? I started as a ballet dancer in Moscow. Soviet Union was collapsing. I was very lucky to have an opportunity to come to Juilliard School in New York. I came to the United States thinking that I'm going to learn modern dance, something that Russians don't have or didn't have at the time. And I'll come back to Moscow and revolutionize the dance world in Moscow. I had these big dreams when I was 17. I thought, oh my God, I'm going to be like the visionary, okay?
Big dreams, indeed. Okay.
Big dreams. So I showed up.
What year is this?
This is 1992.
1992, okay.
Spent a year in Juilliard, and then after that I got a job with American Ballet Theater. It was a great job to get, so I left the school. I joined ABT. I worked there for maybe 5 years or so. Before I got there, this would be important how I got to medicine, actually. I hurt my back pretty badly dancing in Vail, Colorado for Betty Ford and Gerald Ford. And I had a fracture of my spine. I experienced some pain, went to a bunch of doctors throughout my years, had this chronic pain myself, chronic back pain. And then as a ballet dancer, you don't last, your career doesn't last more than 10 years at the most, maybe 15. By the time you're 35, you're hurting. You can't do this anymore. Some people are lucky. So I said, no, I have to do something else with my head, with myself. I exercised my body, I worked my body, but what about my brain? So I thought, okay, let me go back to school. I wanted to be a physical therapist. I planned out to go to college, get a degree in physical therapy. I enjoyed working with people. It was my kind of a gig to teach physical exercise to clients. But the moment I entered college, the bachelor's degree of physical therapy became a master's, and then almost immediately it became a doctorate. So it was like a big bummer. I was like, oh my God, now I thought I'll go to school for 4 years, and now I have to go to school for 5, 6. So, and while I was in college, I said to myself, you know what? Maybe I'll just go to medical school, whatever. At least I'll have a choice what I want to do later. In medical school, I couldn't pick a profession very easy. I didn't know what I was going to do. So with my dancing career, with my knowledge of musculoskeletal system, knowledge of the body, I decided to go into something which I can, use. I didn't want to be a surgeon. My surgical rotations were awful.
Most are.
I said to myself, this is not my first career. This is my second career. I don't want to struggle like this my entire life. So I said, okay, no surgery. Well, if no surgery, if you still want to do orthopedics or musculoskeletal medicine, physical medicine and rehab was the thing to do. So I did that. I did the training in physical medicine rehabilitation. For some reason, actually I know why, the reason. Back in early 2000s, unless you got fellowship in pain medicine, you were not considered to be a real doctor, at least in PM&R profession. At least in the East Coast, at least in the residency program where I was. It was extremely competitive. It was this new thing, pain medicine. That's, it's going to play a big role in my life later.
So for PM&R, you needed to do the fellowship or the...
You didn't need to, but most of the people strive to do it because it would make you a more competitive candidate. It would make you more, will get you a better job essentially.
So you went from bachelor's to needing a master's and then needing, then you get into medical school.
This is what destroyed me at the end. This is what got me in trouble at the end. I'll tell you all about that. So I did a year of pain fellowship. Then I joined the private practice. I started out as a pain medicine physician, or they used to call us pain management. I hate the term, by the way, because it has nothing to do with medicine. And I joined the private practice. I started working, and I realized that this is a disaster. I couldn't understand why. I didn't know why I couldn't do it. We were just writing narcotics to anybody and everybody.
This is post or during training? Post training? During training.
During training and post training. Because in training it's one thing. Okay, your fellowship director, your attending tells you
moved around with you.
Yeah. So your attending tells you, okay, this is what you do. You basically can give these meds, and then you inject steroids into spine and into every joint. So I thought it was okay, cool, fine, no problem. But then when you start taking care of the patients yourself, these become your patients, and you are very invested in the outcomes. And what we did, we just put these people on opioids, on tremendous amount of opioids. And after I started seeing really, really bad outcomes, it was just, the outcomes were disastrous, okay?
What year is this?
Disastrous. This was close to 2010, 2011.
Got it, okay.
I had no idea what was happening. Scientifically, I couldn't understand. Hey, everybody was doing it. I was doing it. I was trained to do it. But something felt really, really wrong. We had people dealing our medications in the parking lots. We had people overdosing. We had people lying to us constantly. very, very few people came to us with legitimate complaints. I felt I was a part of basically a pill mill.
Yeah.
And I was, I was. So I walked out. I walked out after a year. I packed my bags. I had a wife. I had 2 kids. I walked out. My ex-wife hated me for that because, we needed the income. And I said, I can't do this anymore. I just can't.
All right. Morally.
Morally. I wasn't sure why. Scientifically, again, I didn't understand how come I'm doing what the science is telling you to do. Well, that turned out to be actually not the case. The science, we were lied to. The science did not make sense. So after I quit my job, I started reading. I started looking into pain journals. I started reading the literature. And guess what? In medicine, we pride ourselves. We do evidence-based medicine, right? Whatever we do, show me some evidence that it works. If it doesn't, why are we doing it, right? I thought that was what medicine was about. Well, turns out pain medicine, the only specialty named after a symptom, right? That's true. We don't have a constipation medicine, right? We don't have a itchy medicine.
No fellowship for that, no.
No fellowship for that, right? We don't have anxious medicine or anxiety medicine or depressed medicine. We don't, but we have pain medicine. I started reading and I realized that there was not a single piece of literature which tells you that chronic narcotics help chronic pain. And this is what we've been doing. So it didn't make any sense.
Right.
It made no sense to me whatsoever. Again, I didn't understand the reason for the medical field doing what we were doing. I constantly had drug reps knocking on my doors, selling me fentanyl lollipops, lozenges, and telling me that now I have to prescribe fentanyl lozenges for the treatment of back pain.
I was going to ask you about that.
And I looked at this in horror, but everybody was doing it. I felt like I was complete outcast, So for a year, I did it. I believed in it. So then I just walked out.
Oh, before you continue, so where were you at this time? Were you in New York?
No, this was California. So
you're back in Cali.
This was already California.
When did you come to California?
I moved to California in 2009, 2010. Yeah.
Okay.
Yeah. So 2011, we started working in Orange County in the pain practice.
Have you seen like the documentaries and films about the things that were going around with
None of that came out yet.
Yeah, but that's what you're describing. Yeah. Everything you're describing is exactly what's in the what's in those documentaries.
Right. And I'm looking at these documentaries now, believe it or not. There was a documentary on Netflix. I couldn't watch it because it was so true. I truly had the symptoms of post-traumatic stress disorder just watching it.
Wow.
It was so bad that it was so true what happened. Yeah. And I was part of it. I was like right in the midst of it, doing what these people were showing in these documentaries, just writing drugs.
Right.
We had people bust to our practice from Los Angeles in a buses to get off the bus, show us some bogus X-rays, saying this is the break in my hip. I'm in pain. Give me my pain meds. At that time, doctors lost medical licenses in courts for not prescribing enough pain meds.
For not prescribing pain meds, because we were like, okay, you're a bad doctor. You have to treat pain, right? In the hospitals where I worked, and I was privileged in maybe over 20 hospitals here in Orange County, Los Angeles all the way down to Mission Viejo, we were encouraged by anybody and everybody to give as much as a person would need. Nobody questioned why they're there. Now funny, I'm just remembering this. I used to work at a hospital, community hospital. Maybe I should mention the name of the facility, but I can bleep it out. Don't worry.
we were the destination for Dilaudid.
Wow.
We were the Dilaudid tourism destination. Dilaudid is one of the most potent opioids that we have. So people would walk into the emergency room and they will say, I have a hangnail, I have a little bruise, and the emergency docs will put them on dilaudid. And I didn't understand why. So I went to the emergency department myself and I said, why do you have to give IV dilaudid to everybody? And the question was, because this is the best medicine for pain. And truly it is.
Well, it is. That's a fact.
Yeah. So, and then I started asking the patients, I said, hey, where do you live? Oh, you live in Temecula? What are you doing in Oh, you were just passing by. Well, where do you live? You live in, you're from Thousand Oaks? What are you doing in, oh, you have a cousin who lives here. And then you start seeing the patterns.
Right.
And then I got privileged in a sister facility in Los Angeles. And the emergency room department was run by the same private group, by the same doctors, and it was the same story. We would just come in. And what happens in the emergency department, whatever the ER doc puts you on, those orders gets carried over to the floor. So once the patient hits the medical floor, the same orders continue. So the patient keeps getting dilaudid, IV dilaudid. Now, there are people who need it, okay?
Absolutely.
There clearly are people who would benefit from it, but for
Not
the
people with
majority
hangnails.
for the majority of my consults, the consults what I would get as a pain doctor, pain medicine doctor, were, hey, patient is on dilaudid every 3 hours, and they're still complaining of pain. Come and do something about it. Well, my answer to it was that, well, what am I supposed to do? There's nothing else for me to give.
Right,
you know?
right.
And
they're going to stop breathing if I give more.
And you would show up to the bedside and you see this person walking around. And then the moment they see, they're like, oh, are you the pain doctor? Are you the pain doctor? Oh, my God, and then they will give you the story, try to get more medications out of you. And I would write in the consult after consult after consult. Look, if you don't have to give dilaudid, don't give dilaudid. Give something else,
Right.
But the reality is nobody reads the consult. And even if they do read the consult, that doesn't serve anybody's interest in the hospital. Because the patient who is there possibly, let's take an example of the most of my consults were unfortunately people who were, I'll put it simply, drug seeking. Because they came from Temecula, they already learned that once they get to this hospital, they're going to get IV dilaudid for, if they just mention the word pain. So now you came in and you're going to tell them you don't need dilaudid. You're going to be okay with Tylenol, and or
how did they take
ibuprofen.
that? Yeah.
So they're going to be really pissed. So then you get the patient pissed, right? Now the nurse taking care of that patient is also pissed because the patient is pissed. The nurse calls the attending doctor, who is also going to be pissed because now you just created this big mess in the floor. And then the attending doctor calls you. What have you done? Well, you can say, look, I think I've done the right thing because this patient is clearly here for a different reason versus did I just take a medication that they possibly need? Because again, the pain is such a subjective thing. How do I know? I don't know. We don't have a marker.
Right.
But if you've seen enough of these patients, if you've seen enough of these people, you would kind of have a understanding who is there for what reason and why they're asking for IV dilaudid, And again, having my own back being broken at some point and having a pain for a year, I never take a single pain med. So I then later, what happened is I went back to physical medicine and rehab. But in my profession, in my old profession, one of the mistakes that we have, we treat patients with chronic pain as if they had acute pain.
Right. There's no way to discern.
There is no way to discern. There is a artificial time guideline. Okay, if back in the days it used to be if it's more than 6 months, consider it a chronic pain. So then what? You change your treatment algorithm. You wait until Tuesday, December 22nd, and that's the 6 months mark, and then you change the algorithm. No, that's not how you do it. But we treated everybody like they had acute pain. Chronic pain, nobody understood, nobody cared to understand it, nobody even bothered because It's very tough to deal with. There's so much involved in it. So it would be much easier to just give somebody medicine. Why did we decide to put everybody on pain pills? People ask me, well, how come we didn't do this in the past and now we're doing it? Well, it was very simple because one of the people who was practicing, still is practicing, by the way, in New York, decided to do a little study. He was working in a cancer center in New York City, treating cancer patients with opioids. And he said, why not give these medications to non-cancer pain patients? And it was a great idea. Why not? People were so afraid. Oh, we only give opiates to people who are dying, and we only give narcotics to people who are like really, really end stage. And he said, no, nonsense. And you know what? It was a great idea. It was. Why not treat pain? Why not?
In theory.
In theory, So they did a study. They looked at, I think, like 100 patients. They published and everybody did great out of that 100 patients. I think one patient dropped out or something because of constipation, if I remember correctly. And everybody did great. They followed them for a few months, and sure enough, everybody's pain improved. Fantastic. Well, there appeared a little editorial on the last page of one of the last pages of New England Journal of Medicine. And people from Purdue Pharma, they do read New
Purdue
England
Pharma.
Journal of Medicine. Yeah.
that company. Okay.
That company, know. So they read the editorial. They said, "Oh my God, this is great stuff." So they came back to that particular physician in New York, and they said, "Listen, we're gonna help you. Let's do a big study. Let's study this. Let's get people on these meds because people are hurting. We have such high incidence of chronic pain, and we declared a war on pain. Right? Makes perfect sense. Why not?
They seem very interested in helping people. Yeah,
absolutely.
Yeah.
And I truly, that we laugh at it. That we're like, yeah, we know what happened. You and I know exactly what happened. But back in the days, I really, really think that these people actually were. They were not trying to harm anybody.
Well, no, but making money and not trying to harm people can be two different things.
Yeah, absolutely.
You just don't care about harming people. You don't want to harm people. You just don't care.
Right.
That's two different things.
Yeah, you're absolutely right. So what happened is then that's how pain medicine was born. Actually, that was the birth of pain medicine. I think we're talking about late 80s, So by the time I came into the picture, that was what everybody did. I mean, they used to put doctors on cruise ships, send them to the Caribbean with their dogs, with their pets, with their husbands, with wives, and just wine and dine them for a week, in exchange for 2 hour or 3 hour of lectures on how not to kill anybody, prescribing this. And initially, it was not bad. People weren't complaining. Everything was going smoothly, people were prescribing, and we figured out how to do it safely. It's actually not hard to do it very safely.
And by safely, you mean just
not to kill
dying.
anybody.
Yeah, not dying. Okay.
not killing anybody. That's what I mean by safety.
I understand.
So, but the problem was, of course, nobody followed those patients for a long time. All these studies, which were mentioned at that time, nobody followed these patients for more than 3 months. So what happened to those people who were on these chronic opioid medications for a long time? Okay. That's when the harm started showing up. That's when the true face of the problem started showing up. And yeah, look, I'm not trying to downsize the risk of dying from opioids, risk of overdosing, or risk of being addicted. These are the big things that we do know and we do talk about, right? I think one of the worst possible problems with an opioid that it, instead of giving you less pain, it gives you more pain. And people don't understand that. And when I used to bring this up in my lectures in hospitals, they looked at me like I was an idiot. I was some kind of a renegade. I was ostracized for even mentioning this. But
what do you mean by more pain?
Well, there is something called opioid-induced hyperalgesia.
Okay.
Right. So it's actually pain. In English, it's pain because of of an opioid. And actually in psychiatry, in old school psychiatry, we used to do something very similar. We would assume that your body doesn't change and we introduce something new, and therefore we hopefully improve the function, and then we're going to achieve a new steady state. So the whole theory is, okay, you have pain, therefore we're going to give you pain medication. We're going to occupy a certain number of the opioid receptors in your central nervous system, and this is how you're going to function.
Right.
Well, guess what? The brain adjusts. The brain and central nervous system is not just going to sit there and say, okay, great, now I have pain-free existence. Whatever we introduce to the central nervous system, your brain either going to adjust or it's going to fight, or it's going to, adjust in some other way. So with an opioid, well, let's backtrack. So we do make our own opioids, right? Endorphins, encephalocins, and things like that. So now I'm giving you opioids, which you make endogenously inside of your own central nervous system. Now I also introduce a source from outside of your body. So your own body now says, wait a second, that's great. Now I don't have to make my own. Why would I make effort or spend the energy in making my own endogenous opioids? I don't need to do that. Well, then what you experience is tolerance to these medications. Basically, once you start occupying, let's say we only had a finite number of opioid receptors, 100 opioid receptors. I've given you a dose of medication which is going to occupy 25 out of the 100. Well, we thought that, okay, great, that's how things are going to be. This is going to be the new steady state. Well, it turns out not to be so, because now your body is going to say, whoa, wait a second. Why is 25 of my opioid receptors are being chronically occupied? I need them. I don't need them to be occupied. I need them in case if I have to have to respond with more opioids for something painful. So your body is going to start deleting those receptors. Therefore, you experience tolerance. I'm kind of oversimplifying it. It's not like really what happens in the within opioid receptors per se, but just the idea. And then you develop tolerance, meaning that now you need more of an opioid to achieve the same state or to same pain relief. So we increase the dose, your body fights back. We increase the dose, your body fights back. And eventually you come to the place that your threshold for feeling the pain drops. Because now you don't have opioid receptors. You burnt them all out. So now introducing a stimulus to you, which is going to be uncomfortable for most people who are not on chronic opioids. And if the person is on chronic opioids, that stimulus is going to be painful. So this is the opioid-induced hyperalgesia.
Got it.
So you put somebody on an opioid, they're not going to have less pain eventually. They'll have more pain.
Is this with some people, or is this with most people?
You know, my belief is that it is certainly probably not the case with everyone. But again, everything what I say today is I come to with a bias of what I see in addiction medicine and the chronic pain medicine practice. So people don't come to me because they're happy with what happened to them. You know,
sure.
I only see people who were harmed by this practice.
The toughest cases.
You know, so I have a feeling, not a feeling. It is well documented that some people will have more of that, some people will have less of that. But it's my true belief that if administered chronically, your body will adjust to the medication, will change its anatomy, if you wish, and it will adjust your pain response. So I think it's just a degree to which people will, develop it.
Yeah, so the tolerance will happen probably to a lot of people, but the hyperalgesia.
Tolerance happens to everyone.
Yeah.
I have a feeling that the hyperalgesia also happens to the most people, probably all. It's just maybe.
If the tolerance gets high enough.
Yeah. But it's, to some people, it's going to be devastating. Some people it's going to be completely devastating, and. So yeah.
Right. So what year is this? A year and a half when you walked away?
This was probably 2012.
Okay. And since 2012, what have you been doing?
Well, since 2012, I'm glad that you asked. So that was the darkness.
Okay.
I entered into a pretty dark spot. Imagine I had a very, very optimistic dream. I'm going to go to medical school. I'm going to get an education. I will never have to, worry about getting a job. I thought I will be helping people, curing people, and living in this quasi-imaginary, happy world. And it happened to be just exactly of what I thought it was going to be. So now, here I am.
The opposite of what you thought it was going to be.
Almost exactly the opposite. Imagine now, and I'm just talking about professionally. Same thing, my personal life kind of happened in the same pattern. But professionally, now I realize that I went to school for 8 years, right, plus 4 years of college, and everything what I've learned, I've used to harm people, not help people, harm people. What I've done things that I used to say I'm ashamed, but I guess these days I cannot say this because that was just how we did things back in the days. But I've put people on 450 micrograms of fentanyl patches. I've implanted pain pumps into just anybody if they complain about pain, so we can get these people into the surgical center. I've injected people for good reason and not good reason, just because it was a thing to do, and people were saying that they needed an injection because their lawyers were saying that they needed an injection. It was a dark, fraudulent practice. So now, I like to think of myself as a decent human being who, didn't go to school for 8 years to end up like this.
Right.
So it was a crisis. It was a personal crisis. So I went back to nursing homes, picked up some work as an insurance reviewer.
This is not related to prescribing opiates or anything of that
Right,
nature?
right. I said to myself, I will never prescribe another opiate in my life.
Okay.
That's how I said it, yeah. I'm in addiction medicine, so let's just get straight to the point. This was the time when my drinking went out of control.
Right.
So give you background. Most of my family are alcoholics. So addiction is just rampant in my family. My grandmother, I knew that my grandmother was an alcoholic probably at the age when I was like 5. Okay. So my father was an alcoholic who died of the disease. My grandmother died of the disease. I have a bunch of relatives who killed themselves with the disease because of the disease. I mean, alcohol and the presence of that in my family is just rampant. My mother and my aunt are the only two people who were not afflicted by it. My own drinking became heavier and heavier throughout the years. And now here I am, hoping for the great medical knowledge and, trying to help everybody, and having had hope that I will never have to face any kind of darkness in my life. And everything just crashed. Okay,
Gotcha.
My personal life crashed, my professional life crashed. And the drinking picked up. It was a great medication. I found the medicine for myself. I said to myself, "Wow, this is great."
Yeah. Not worried about anything anymore.
No. Now I was like, "Well, that's why my father did it. That's why my family did it. That's why everybody around me are doing it." And little by little, took me a few years to deteriorate. I want
to get the timeline down. So up until this point, did you have a drinking problem?
I'm sure I did.
Okay.
Yeah. See, the disease tells you don't have the disease.
Okay.
So yeah, I did have the disease.
Okay. It just got worse after you walked away from. Okay.
Oh yeah.
Okay.
Oh yeah. So now I really realized that alcohol became a daily medical need, if you wish.
Did you have the classic symptoms of having to wake up and have a drink before you start your day?
Absolutely. Later.
All of that?
Oh, absolutely. I've gotten to that point. I've gotten to very, very lows, and I'll tell you about the lows as well. So, but to backtrack, yeah, it all started with like a little drink here, a little drink there, and then I did realize that I just have to drink every day. because that's just how life was. In the back of my head, I thought, my God, I think I'm an alcoholic. But of course, look, I'm a medical doctor.
Yeah.
I'm a doctor. Look, I can take care of this. I know. I don't have a problem. I do have a problem, but nothing outside of my control.
I got it under my control.
Of course,
Of
I'm
course.
Russian. Everybody drinks. This is my culture. This is in my blood,
Literally.
Literally, yes. It was given to me by my mother with milk. My mother never drank, which is the funny thing. She even now she does not care for anything.
Oh, so your mother didn't use her dad's side of the family that drank?
That side of the family, my mother's mother and my mother's father. My mother's father also died because of an alcohol.
Got it.
Which was served to him while he was assembling atomic submarines.
That's tolerance.
That's tolerance in the Soviet Union, okay? So I met this gentleman, Stuart Finkelstein, was an addiction medicine doctor, was an internist, family physician in Lakewood, who heard one of my lectures where I talked about opioids. And I said, look, guys, we're doing the wrong thing here. And as I was booted off the stage by most of the doctors, Stuart came to me and he said, hey, you and I have to talk. I was like, oh, okay, great. He was in addiction medicine. Later on, we became quite friendly. And he would always talk to me and say, hey, when are you going to come and help me? I knew I had an issue. I knew I was an alcoholic. And I had no interest in studying that because
alcohol? Yeah.
Oh yeah,
Okay.
addiction medicine. I had no interest in doing this because I thought I got it. I understand it. I have it myself. Why would I want to go there?
So you were PM&R, but you also practice pain medicine, but not addiction medicine.
Not addiction.
Okay,
So
understood.
addiction medicine was a disease of mine.
Got it.
Addiction medicine was my addiction is the diagnosis. And of course, back in my head, my disease was telling me, hey, it's okay. You got it. You don't, there's nothing that you cannot do. And if you really want it, you could probably stop. You could clean up your act. Thank goodness I was functional to the point that I never hurt anybody to the best of my knowledge. But again, of course, how do we know? We don't know, Anyways, he drops dead, and I get a call from his office manager who basically told me, listen, there is nobody in town but you who understand anything about these people because of my background with opioids, with my knowledge about opioids, with knowledge of the receptors and the drugs and pharmacies and all of this stuff. So that's how I actually took over the practice.
Okay.
When I took over the practice, I thought my disease is going to get better. It got worse. Addiction does not get better. It gets worse, 100%.
Why did it get worse?
It got worse. Probably, that's an interesting question. That's an interesting. I blame it on COVID.
Yeah, the reason why I asked that is because you can look at addiction from a biological perspective or from like an environmental perspective. You've already mentioned that you have a family history of it. So there's some genetics involved there, but not everyone that has the genetics is going to have the environmental part of it.
Absolutely.
So I was curious if you were working with somebody that you admired and was it the guilt that you felt? Like, what was it that made you spiral into drinking more? What was the environmental part?
Probably a lot of subconscious things. A lot of subconscious things. Well, see, usually people self-medicate for a reason.
So you were self-medicating?
Some people will medicate because of anxiety. Some people will medicate because of insomnia. Some people would medicate because of depression. Some people would medicate for, I don't know. See, in Russia, you don't drink because you're depressed. You don't drink because you are anxious. You drink when you're happy.
It's Monday.
You drink because it's Tuesday morning.
Right.
Because you and I were just sitting here. Back in the days, I would have wiped out. I would have put a bottle of something here with us. You just celebrate because you and I are hanging out and talking to each other. That's how the culture is, right?
Got it.
So. Subconsciously, I'm sure there were a lot of things going through my head. I did go see a psychiatrist. I did see an addiction medicine doctor who
Okay.
did say that I was quite a severe alcoholic and I did need help. And of course, what did I say? I said, ha ha ha, yeah, sure. But I took the advice seriously. I was still married, so now to add to this, my home life with the divorce, which alcohol had a lot to do with.
Okay.
A lot to do this. The incredible behavior that I exhibited, the mess that it has created for my entire family.
And this is around the same time that you were potentially taking over that other practice.
That was a little bit before that. The
before.
divorce happened before that. So I moved out. I was living in some shady apartment somewhere in Huntington Beach. It was quite a story. Was it like a bachelor's hat? Not like yours. It was messy. It was messy. With bottles of wine all over the place.
Okay, so that's happening, and then I guess you could say your mentor passes away.
And the mentor passes away.
Right.
I take over the place, and then there was this huge boost of energy toward me. It's like, oh my God, now finally I'm doing something that I can potentially do.
Okay.
Finally, I can relate to these people because I have the same thing. But oh my God, look at myself now. I was looking at myself in the mirror every single day I showed up to work. That was kind of painful. Finances, personal life, whatever, depression, this, that, everything combined,
Environmental factors.
Everything combined, environmental factors. And finally, when the COVID hit, I locked myself up and there was nothing to do. There was nothing to do but just kept getting depressed and kept getting worse and worse and worse. I did have this is the amazing thing about being a doctor alcoholic. It's like, I was like, okay, I'm a doctor. I'm an alcoholic and I'm a doctor. I'm going to cure myself. I called my mother and I said, Mother, I'm an alcoholic. She says, well, I'm not surprised. All of your family is, So I said, dear mother, I need you to find me a rehab place in Moscow where they can implant me with subcutaneous disulfiram. Disulfiram is the anti-abuse, that we prescribe here to take orally.
Yeah.
And if you do drink on that medication, you have a horrendous reaction. You cannot drink on it because to me, that was the only way out because everything else failed. Now, I did try. I went, I sought a psychiatrist. I tried this medication, tried that medication. Because I was brought up in the Soviet Union, I was told that Alcoholics Anonymous AA was not for me. That I wouldn't tolerate this. I wouldn't relate to them, and they were partially right at that time.
So throughout this time, you were trying to quit.
I was. I was putting an effort while I was still married. I was trying to salvage my marriage. So it wasn't my first try to quit. So I went to Moscow, and my mother arranged for a clinic to implant me with disulfiram. It's an implant. It lasts anywhere from 1 year to 3 years. So I showed up in the Moscow clinic, and they said, I walked in and they said, okay, here, okay, put it in me. Mm-hmm. Give me the disulfiram. I can't drink anymore. And they said, no. Wait a second. Let us talk. I said, what do you mean? I'm a doctor here. I'm coming from the United States of America.
Right.
Okay? And now all I need from you guys, here's the cash, and you implant me with the disulfiram.
I didn't come here for conversation.
And exactly. And they said, no, relax. We have a spa here. We're going to give you this treatment, that treatment, that treatment. I was like, okay, fine. Since I paid, let me experience what you guys have. And in between all the wonderful treatments that they were administering that day, a psychologist would come in and try to talk to me and try to tell me. They were very careful. They said, look, we understand, but why won't you do the right thing for you? Why won't you try the real treatment? And in my view, I'm a medical doctor. Listen, what is the treatment? Well, I either give medication, I inject, and this is what's wrong with the medical system. You have a problem, I have a pill for you. You have another problem, I can fix it for you. That's how I thought medicine functioned. Mm-hmm. Okay, I knew that disulfiram, you cannot drink on it, so therefore I knew this is what my solution is going to be. I failed to listen to these wonderful people who told me, you're basically an idiot. That's what their message was. They're like, you have no idea what you're dealing with. You are a total idiot. But you want your disulfiram? Here, have it. So at the end of the day, they implanted me with it.
Okay.
I came back. I didn't drink for 9 months.
Okay.
For 9 months. And then, of course, I'm a scientist. Oh, and by the way, I figured out how to beat disulfiram in the pill form.
How to beat it?
How to beat it, yeah. You and you take some. You can still drink with it.
No vomiting, none of that.
No, none of that. So please don't spread this as a prescription.
Maybe
to the
maybe we'll edit this out. But why were you taking the disulfiram if you were just gonna block it? Was that just the addiction talking, or was?
Of course.
Okay.
Of course, for your wife, I wanted to show her that I do take it. And for myself, I wanted to take it. Do you really think any alcoholic or any addict want to be what they are? No, we don't.
They want to drink, but they don't want the stuff that comes along with drinking.
You can put it this way. Yeah, you can put it this way. But unfortunately, there is no way out of it. And again, it's the disease which tells you don't have a disease. And the craving for it, the need for it,
right.
is because you're not in control. You take the pill, but then in the next 3 hours, 4 hours, something happens. You have a negative reaction to whatever during your day, and you're like, okay, I need my drink, and oh damn, I have disulfiram in the system. So
Oh, okay.
that's how it works, really. At least that's how it worked in my head.
So you wanted to stop, but you
I
still
wanted to
need
stop,
it. But you can't have one without the other.
No.
Yeah.
No.
The drinking, I think you mentioned earlier, the drinking actually helped you take away some of your problems, like in terms of
Yeah,
relaxing.
of course it does. Temporarily. This is an opioid. This is the narcotic for pain.
Right.
This is the beautiful similarity.
Yeah.
You take the narcotic for pain, at first it works beautifully. It's amazing what it does.
But
later it turns exactly against you.
Right. But then there's
It
cravings.
gives you more pain.
Your behavior changes. Right.
Same with alcohol.
Yeah.
At first, it works beautifully. There is no problem. You have a drink, you go to the party, you can talk more, you can socialize, you can, invite the girl to a dance, whatever it is. But then later, it does exactly the opposite. It turns exactly against you.
Okay.
And that's the similarity, I'm glad I've learned that. I'm glad I've learned that from a scientific point of view, looking at opioids. I was never hooked on opioids. I never had opioids in my life. Once I had a morphine shot, and I was like, never again. I was in heaven. I knew I would be an addict in an instant.
Right.
I knew that.
That's why I don't do coke, by the way. I've never done it, but I would probably like it too much.
And that's the scary thing, because we know what it does.
I'm not messing with it.
I was 15 or 16 years old. I had my Achilles tendon repaired, and the nurse came in and she gave me a shot of morphine, and I was in heaven.
Yeah.
I was in heaven. So all of the doctors I used to work with, I said, if you see me in this hospital bed, you do not give me opioids.
Yeah.
Because I will be in heaven, and I will be hooked immediately. Yeah.
So wait. So you're 9 months later, the disulfiram, the injection. Where are you? You didn't drink for 9 months.
So 9 months, I'm sitting in my balcony in Huntington in my bachelor's flat, and there is half a bottle of wine from some visitor sitting on top of the refrigerator. And I said to myself, well, of course it's not going to work, but I'm just curious. What's going to happen to me? I drank it.
Okay.
There was no effects from disulfiram, from an implant.
It had worn off. Or
it either worn off, or what I really think what happened, they gave me the placebo.
You think so?
I'm pretty sure.
Wait, but did you? Oh, that's interesting.
So
if you go back to month 1, month 2, did you have a craving to drink?
It's hard to remember now. It's been a while, but
you just knew not to drink.
I knew not to drink. At some point you psych yourself up so badly. Like you've gone to Moscow, man. You sat on the plane for 15 hours. You've took a week off to do this. You managed to sober up. You it's a big undertaking. I mean, I was like bleeding in the bus, and after they did the implant.
Oh, yeah,
You know,
yeah.
I mean, I was like sleeping in my mother's couch in Moscow. It was in the middle of the winter. I mean, that whole experience sobers you up. You're like,
Got it.
dang, I better not. I better freaking not.
So did you experience cravings? You just didn't drink.
I didn't drink. You know, I was a dry drunk, what we call a dry drunk. I was a drunk without the alcohol. And what is that? What is a dry drunk? You know, alcoholism or any addiction doesn't just come with fact that you're intoxicated. It comes with the change of your behavior. It comes with the change of your ethics. It comes with the change of your of you as a human. You stop acting as a human. You know, everything evolves around alcohol. You become the center of the universe. It is everybody else's fault. It is everybody are trying to do something. I mean, the delusions that your brain creates and the consequences on how that translates into your relationships with other humans, what it does is incredible. It's what it does to you is incredible. So you can remove the alcohol, or you can remove the opioid, or coke, or anything else. But an addict, by definition, or these days we call ourselves person with a substance use disorder. Let me be clear here: an addict, an alcoholic like me. It is more than that. It's more than substance. It's being a total, complete, if you wish, an a-hole to just about anybody and everybody. So it destroys you as a human.
Is that what they were trying to tell you in Russia?
What they were trying to tell me in Russia, that this will not be your medication. It will not be your cure. What you're doing is exactly the wrong thing to do.
Okay.
It's inappropriate, and this is why they looked at me once and they realized that I had no idea, no understanding of the disease, no understanding of what I was dealing with. And I truly was absolutely clueless. Absolutely clueless.
Because you still thought that you had control?
Because I thought the alcohol was the only problem.
Got it. Yeah.
You know, it's the substance. You take the substance away, that's it. You don't have the problem. And this is what the biggest obstacle into treating people with the same disease.
Got it.
Because people don't get it, especially people who have the disease, which tells you don't have the disease. And now they're going to listen to somebody else telling them that the substance that they're hooked to is not their disease. It's not. This is the gateway into a complete spiritual demise.
Got it.
That's what it is.
Okay. So you wanted just the medication. You didn't want all the other stuff. Okay.
I had no idea. I was one of the patients.
Right.
Take the alcohol out of me. I'll be stellar human. I'll be good as new. I'll be good as new.
No matter where you go, you are.
Yeah.
You're still there. Okay.
And that is exactly why I had a relapse. That is exactly why I had a terrible relapse. And that's exactly what brought me finally to the point where I ended up in the hospital in intensive care unit with my blood pressure being 70 over 47, with 3 ICU members trying to pump me with the bags of normal saline, and that's how my life was saved.
Did you say 57 over 47, folks? If you're not medically trained, that is not a good.
It's not good blood pressure. It's not a good blood pressure. Later, I actually looked it up. There was a 70% that I was going to live, but there was a 30% I was going to die,
which is high. That's a high percentage. Okay. All right, so you're in the ICU. How much did you drink?
My regular amount, but as I said, it was during COVID. So during COVID, I actually became, I never binged, but I went on a binge.
Yeah.
And the binge lasted probably, there was no work, there was nothing to do.
Got it, yeah.
And, again, when you're a normal human being and you don't have things to do at work, you're like, great, this is vacation. You can do something else productive. You can go call friends, you can get in the car, you can drive somewhere, you can check out the nature, you can go to the gym, you can do anything you want to do. It used to be my absolute, dream come true. Because I worked pretty hard, like we all do, 7 days a week for months, no vacations, no breaks. But when when alcohol takes over you, your idea of recreation becomes very different. Now you're like, great, I don't have to work today. In Russia we have a saying. It's a very true saying. It's funny, but it's tragically true. Have a drink in the morning, and then the rest of your day is free. So that's how I operated.
Got it.
Have a drink in the morning, and then the rest of the day, what you can do, you can just continue, and that's how your day is going to go. So, and then I got a pancreatitis. That's how I ended up with pancreatitis. And when things became bad, that's how I ended up in the hospital. Finally.
Got it. So you get up from the hospital, then where? Then what happens?
Well, if you are familiar with 12 steps, step number 1, you admit that you have no control. Yeah. You have no control, and you absolutely lost all of the control that you thought you have. And that's the hardest thing to admit. But for me, that my step number 1 was very, very easy. Because when you're laying and you're looking at the blinking lights and ICU and, people running around, and you look at the monitor, and then you're kind of dozing off into God knows where. After I woke up, the first thing which came to me, it was actually relief. It was the most amazing feeling. I was like, oh my God, I truly have no control, because there's nothing I can do at this point.
Right.
There is no reason of pretending, lying to yourself, lying to others, trying to hide anything, trying to deny, trying to explain. It is most beautiful liberation that you can have. It is so pure when there is nothing to hide from. It's you're exposed. It's 100% exposure to whatever you believe in, higher power, God, God, doesn't matter. But you're naked. You're naked in front of a creator, or, whatever your belief system may be.
Right.
There's nothing to hide from. So that's how you realize that this is it. There's nowhere else to go. And once you've been to that place where, after 30, 40 years of your life, you all of a sudden feel like a newborn with an experience of 30 or 40 years of life experiences, but yet you now feel like a newborn again. You're completely pure of everything. It is truthfully amazing. So once you have that experience, going back is kind of not an option.
Got it.
I mean, it's always an option.
Well, yeah, of course.
But it would be a very, very stupid option to ruin this wonderful bliss, if you wish. You know, in Buddhism, we talk about achieving nirvana. To me, that was a nirvana.
Waking up in the hospital bed, you mean?
Yeah. Realizing that this is it. I've lost the battle. Losing sometimes is the biggest win that you can have.
A lot of winning happens after losing, because you learn a lot from the experience to make sure it doesn't happen again. Sometimes you got to lose real big and real bad before you start to care.
Yeah. So that was my birthday, if you wish. And
what year is this then?
This is 2020.
Okay. Oh, this is right in 2020. Okay.
This is 2020. Yeah, this is 2020. November 4th, to be exact.
So the end of, you're right in the middle of COVID. Okay, so it's the end of 2020. Now where do you go?
Well, now the hard work begins. Now, passing the boards of addiction medicine and learning everything in the book this is what differentiates from being smart and actually practicing what you preach. So then now you have to learn how to practice what you preach. And that's the beautiful journey. That's That's what is completely fascinating. People say it's not the destination, it's the trip, it's the road. And that is completely true. So again, I was like, okay, well, I guess being alcohol free does not mean that you are sober. That came to me. Realization finally arrived to me in the hospital. I had a doctor come in and he's like, so what are you going to do? I said, well, I'm going to go back to Moscow, check myself into the same place where they wanted actually to help me, but I refused to help because with, my insurance wouldn't pay for extensive things here. And I wasn't disabled. It was financially not feasible for me to all of a sudden quit everything with my obligations to 2 children and my ex-wife and, still having to pay all this money.
In the U.S.,
in
but
the
Russia,
U.S., but
okay.
Thank God I had an option. So I went home. I was in bad shape for maybe a month, like really in bad shape. It was hard to walk. I had a neuropathy. I was diabetic. Physically, I was sick. My ex-wife saw me in the hospital. In the office, and she looked at me and she's like, "Andrei, you're disabled," and she was right.
Mm-hmm.
But then little by little, the body's amazing. The body recovers. Well, the mind is a beautiful thing. You come to realization that whatever you did before didn't work. I've tried, and I thought I did put in the effort. I've engaged my wife at that time. I told her I need help. We went to the doctor. I've tried all what the doctors had to offer. I've tried this medication, Disulfiram, the naltrexone, everything. I even went to Moscow. I got the implant. I did reasonably some work, but that work was very superficial, and I was trying to rely on external interventions. You are the doctor. You do it for me. You give me the medication. You do the implant, and I'll be okay. You tell me what to say, how to pray, whatever, and I will get better. I think that was the realization for me that doesn't work that way unless you work on yourself first and you put the effort. And if you want to change the world, you got to start with yourself. So that was the very interesting realization that now I actually had to do the work myself and start with myself, look at myself. I told you before I went to see this addiction psychiatrist, and he said, "Are you a religious person?" I said, "No." "Do you believe in God?" I said, "No." He said, "Okay, AA is not going to be your thing to do. So don't go to AA. Do something else."
I've heard that before, but I'm not sure.
Yeah, I was like, great. And I was like, AA, let me take a look at the AA. 12 steps, 6 of them mention God. I was like, no. This is not for me, okay?
Right.
If half of the stuff mentions God, not gonna work. Funny enough, I met my anesthesiologist back from the days. I was having coffee in Newport Beach, and I see this guy, my colleague, and he came up to me. We haven't seen each other in many years. That was from the pain medicine days, and he started asking me, "How are you? How are you?" And at that point, I became pretty open. I was like, "Hey, listen, I had a big fall. I'm basically an alcoholic trying to recover, trying to get my life back." And he looked at me, "Oh, congratulations. I'm, 10 years sober. How can I help you?" I was like, "You?"
Yeah.
No way. Not. He's like, yeah. Do you want to go and hang out with other alcoholic doctors? I was like, wow, I guess I'm not the one. I'm not the only one, Let's go. And that was an AA meeting. So I went once. Of course, I listened to everybody. I was like, yeah, guys, sure. Yeah, of course. Yeah, God. Yeah. Oh, sure. Step 3. Oh, yeah. 4, 5. Oh, yeah. Great. Yeah. Sponsor. Sure. Yeah. And then after you're done with the meeting, you're like, oh, man. What the heck?
What were you thinking?
I was thinking, this is not for me. But just the fellowship, just the fact that the collective the sense of belonging to the same people kept me coming back. Kept me coming back and coming back. And actually, I created AA with my recovery. Not because necessarily of what the book says. You know, I don't take any book as a Bible, Quran, or I don't read it word by word, and I don't, you know, that's not how I grew up. But what AA taught me is that my disease were as much of a physical disease as much of as a spiritual disease. What I realized that there is no spirituality in me of any kind. It's completely non-existent. And I still believe to this day that as humans, if we are void of spirituality, we're in trouble, you know. So to me, that disease is as much of a spiritual failure as much of it is a physical failure. Maybe failure not the right word, you know, to use here, but so learning how to first disassemble your ego and realize that it's not about you. You're just a little piece of a puzzle. You know, you're not the center of the universe. You know, and we all come from a semi-similar background. We go to the school, we go to medical school, we study hard, we pass these boards, we strive to be the best. And then you keep building this ego and you keep building it. And the more letters after your name you have, you know, I used to collect letters after my name, you know, you feel more and more inflated, and it's more and more inflated. But once you disassemble this piece by piece, at least in my case, what I've learned that there was nothing inside. It's just empty.
Emptiness. Yeah.
There's just nothing that I built my ego mountain, if you wish, on. There was no foundation
to build it on. Yeah.
That's what AA taught me.
Got it.
So something had to change. So that was the pivotal moment in my recovery, at least, you know. So forget about the substance. You know, substance is easy. You know, you learn, you understand that my brain cannot tolerate this molecule because it's just not designed to tolerate this molecule. My brain is not designed to tolerate any psychoactive molecules, whether it's an opioid or an alcohol or a benzo or anything, you know. I remember laying in that hospital being alcohol-free, and I had benzo on my orders. And I'm laying there, and actually a nurse who was taking care of me was a good friend of mine. So I was like, oh, man. All I need is just to call my friend and tell her that I'm anxious, and she'll give me benzo. All I need to do is call her up and say I'm withdrawing, and she'll give me the benzo. And it was hard. I was like, oh my God, this is it. This is what they're talking about, you know, because to get it is so easy. But then you have to just realize that my brain cannot tolerate this. And this is the message to everybody I'm trying to convey, you know. It's sometimes the easiest thing, but sometimes it's the hardest thing to understand.
All right, everyone. Thanks for tuning in and listening to Dr. Dokukin's personal story. This is part 1. Part 2 will be Dr. Dokukin speaking more from a clinical perspective about what he does as an addiction medicine doctor.